I'm going to first ask you all to put yourselves in a position that should be really easy for all of you to do. I want you to imagine yourselves as intelligent, able-bodied individuals. You have strong language skills, strong math skills. You're very aware of what's going on in the world. You score high on an IQ test. But Monday morning when you get up to go to work, you'll spend the entire morning trying to decide what to wear until your spouse comes in and picks out your clothes for you. And then you go to work that day and you can only see one patient because while you've got all these different treatment options available to you, you're not able to decide on one. And then when you come home that evening, your spouse asks you to make dinner, and you go in the fridge and you pull out all kinds of food and you grab things out of the freezer and you go get a good bottle of wine and you put it right down in the middle of the food, and then you back up and you just stare at it, unable to decide what to make. Now, for most of you, you probably would have trouble identifying with that person because you don't have that level of difficulty making these small decisions. But that's exactly the scenario that plays out in patients who've had brain injuries to the parts of their brain responsible for feelings and emotion. And what modern science has found is that there's this very close relationship between our ability to process feelings and our ability to make decisions, because they occur at the same part of the brain, subconsciously. So a lot of our decision making actually filters through our feelings and what we feel like doing. It's also the reason some of our decisions aren't very good. Some of our decisions aren't very logical. And we see this in practice. We see it with patients that are cataract patients that won't wear their sunglasses, or the contact lens abuser that just keeps on sleeping in their contacts, or the diabetic who lives on a steady diet of pasta and jelly rolls. What are they thinking? Well, they're not thinking. They're feeling. They're doing exactly what they feel like doing.